have a really, really fascinating story where there was two twin boys born with a disease, a genetic disease called Leber's optic neuropathy, which is a disease in which you're born with vision, and at a certain point, usually between 14 and 15, depending on the strain of the hereditary disease, you start losing vision. So you go from vision at birth to gradual loss of vision at age 14 to stone blind. And this patient, the two boys, they were being followed by an expert at Emory University. Okay, and this physician was the expert on Leber's optic neuropathy, and he'd been following these two boys for years. And one of the two boys was completely blind, and the other one had no vision in the right eye and like a keyhole vision in the other eye. So you could see just a little bit like this. You could see, that's all. And they kind of deteriorate at the same rate, just that the second boy was about a month behind the first one. So the mother, for some reason, brought the second child in who had just the keyhole vision, asked me if I could treat him with hyperbaric. And I said, well, I don't know. I don't think I'm going to do any good here because number one is genetic disease, and I can't change the genes. Number two, look what we're looking at. The point is he only has a little bit of vision, and I don't want to promise you anything. I'll try it. And I didn't know much about Leber's optic neuropathy, but to be honest with you, I'm a neurologist, not an ophthalmologist. So when the patient left, or the mother and the patient left, I opened up the computer and I found that it's a mitochondrial disease. Well, mitochondrial diseases are phenomenal responders to hyperbaric therapy because the mitochondria is a part of the cell that's like the engine for the cell. And if you can get that engine to be working again, you can make major changes to the cell and all the cells. So I called the mother up on the phone. I said, you know what? I take that back. There have been some mitochondrial diseases I have seen improve with hyperbaric. Can't guarantee you, but I'm willing to try it if she's willing to try subjecting her son to this treatment. She said, well, first I have to speak to my ophthalmologist in Emory because he's the one who says what I should or shouldn't do. So she went up to Emory and spoke to this specialist in Leber's disease, and he says, absolutely not, don't do it because it can make things worse. And she called me on the phone and she says, he said, don't do hyperbaric because it can make my son worse. I said, well, your son is about a month behind your other son who's blind. What's worse than blind? And she stopped for a second and said, well, I guess you're right. There's nothing worse than, the worst can happen is he'll be there anyway in a month. So I started treating him, and he went from rapid decline to plateauing out, so not deteriorating, to improving, to the point where today he has 20/40 vision in both eyes, which is corrected to 20/20 with contact lenses. He could drive a car, read textbooks. He was in college. His other brother, who chose not to do hyperbaric because he was resigned to the fact that he wasn't going to get his vision back, used a cane to get around and used Braille. I sent the patient back to the expert in Leber's optic neuropathy, and his answer was that's coincidental. It was going to happen anyway. With hyperbaric, I either get, what I'm told from the other colleagues, it's either coincidental response or what's another term? Either coincidental or anecdotal response. So, but anecdotally, if that's the case, he has not deteriorated again. He's not deteriorated at all. I've not treated him in 4 years. So his other brother, who's blind, is still blind. He was treated for, I think, 60 treatments. He has full vision. And he's not deteriorated and did not need any additional therapy. So I don't think that's anecdotal or coincidental.